Let us now go to visual diagnosis of the back. The topic is kyphosis and flattening of the spine. Kyphosis is a round convexity of the spine and upper back at the level of the thoracic vertebrae. It is common in the elderly, more so in women. Kyphosis indicates a decline of kidney essence, and in young people it indicates a congenital deficiency of kidney essence. Here we can see a picture of a person with kyphosis might look like. For kyphosis due to kidney essence deficiency in the elderly, there will be softening of the bones, deafness, weakness of knees and legs, poor memory, loose teeth, hair falling out or premature graying of the hair, weakness of sexual activity, lower backache, infertility, sterility, dizziness, tinnitus, normal colored tongue, and a pulse that is floating empty or leather if its kidney essence deficiency occurs against a background of kidney deficiency. A pale tongue and deep, weak pulse if it occurs against a background of kidney yang deficiency. For kyphosis due to liver and kidney deficiency, there will be lower back ache, dizziness, tinnitus, weak knees, hardness of hearing, dull occipital or vertical headache, insomnia, numbness or tingling of the limbs, dry eyes, blurred vision, dry throat in the evening, dry hair and skin, brittle nails, night sweating, dry stools, scanty menstruation or amenorrhea, normal colored tongue without coating, and a pulse that is floating empty. For kyphosis due to deficiency of the governing vessel, there will be lower back ache, dizziness, tinnitus, poor memory, weak sexual function, and other symptoms and signs depend on whether there is a kidney yin or kidney yang deficiency. For congenital kyphosis, there will be poor bone development, weakness of knees and legs, poor memory, loose teeth, lower back ache, dizziness, tinnitus, normal colored tongue, and floating empty or leather pulse if kidney essence deficiency occurs against a background of kidney yin deficiency. A pale tongue and deep weak pulse if it occurs against a background of kidney yang deficiency. Flattening of the lumbar spine. The flattening of the lumbar spine consists of a decreased lumbar curve. It is often due to a pronounced spasm of the lumbar muscles and decreased spinal mobility. It may suggest the possibility of a herniated lumbar disc. The cause may be liver qi stagnation, liver blood stasis, or cold in the lower back. Here we can see a picture of a person with a flattening of the lumbar spine. If the flattening of the lumbar spine is due to qi stagnation, there will also be stiffness of the spinal muscles, backache that improves with gentle exercise, hypochondrial or epigastric distension, irritability, moodiness, feeling of a lump in the throat, premenstrual tension, and a wiry pulse. If it is due to blood stasis, there will be stiffness of the spinal muscles, rigidity of the back, backache that improves with gentle exercise and is worse at night. The tongue will be purple and the pulse will be wiry. If the flattening of the lumbar spine is due to cold, there will be backache that improves with the application of heat and is aggravated by exposure to cold and dampness. There will be a feeling of cold back and knees, a pale tongue, and a pulse that is tight and slow. Thank you so much for your attention.